Thank you for all joining us today. I'm Michelle Steele, Chairman of the Orange County Board of Supervisors. Today, the Orange County Healthcare Agency reported 115 new cases of COVID-19 and 14 new deaths. This brings our total to 4,841 confirmed cases of COVID-19 and 112 deaths to date. Our hearts go out to the families of those who have been lost. Of today's deaths, 10 of the 14 were from skilled nursing facilities. Patients in these facilities are sick, elderly, and frail, and we must put significant effort in ensuring the health of these individuals. Dr. Quick will provide more information on this topic in her remarks. We are very fortunate to have amazing healthcare workers and top-notch medical facilities to be treating this virus. As of today, we have 247 hospitalizations and 89 in ICU. We hope these patients will recover soon. Additionally, countywide 1,311 tests were conducted today, bringing our total number of those tested to 90,130. Our healthcare agency as well as private labs are rapidly increasing the number of tests here in Orange County so that we can get a more accurate representation of the rate of spread for the virus. More information on where the general public may find testing, including 4 new state testing sites, is found on HCA's website at ochealthinfo.com/COVID-test. This is in addition to our 14 existing county sites. These 4 new state testing sites are in Buena Park, Orange, Santa Ana, and San Juan Capistrano, and they were symptomatic and asymptomatic healthcare workers, first responders, social service workers, and other essential employees who don't have access to testing through their healthcare provider or employer. To make an appointment, please visit ochealthinfo.com/COVID-test and scroll down to Optum Serve or call 1-888-634-1123. We are continuing to work with the healthcare agency and medical providers across the county to continue expanding the availability of testing. I also like to address the fact that in comparison to all our neighboring counties and the state as a whole, Orange County has some very promising numbers. As you can see on the slide behind me, per 100,000 confirmed cases, Orange County has the lowest rate of confirmed cases in comparison to our neighboring counties and the state as a whole. Orange County stands at 147.2 per 100,000, with the LA County at 398.5, Riverside County at 253.4, San Diego County at 179.8, San Bernardino at 173.1, and California as a whole at 210.5 per 100,000. Further, Orange County has the lowest rate of COVID-19 related deaths at 3 per 100,000. This is in comparison to LA County at 17.9, Riverside County at 11.1, San Bernardino at 7.2, San Diego at 6.6, and California as a whole at 8.6 per 100,000. Overall COVID-19 positive test percentages are at 5.2% and slowly decreasing over time. Orange County is testing more. A decreasing positive test percentage is a good sign. Taking all of these statistics into account, Orange County is in good condition as we continue to increase our testing in the fight against this virus. Next, I'd like to address the reopening. I get excited for reopening businesses of Orange County businesses because that is a critical element for our families. Last week, I sat together with the chairman of the Board of Supervisors from San Bernardino, Riverside, and San Diego counties asking Governor Newsom to meet with us to discuss our regional differences and how we can create a reasonable set of guidelines to reopen quickly and safely so that we can explain as a region our differences with his directives and chart a path forward together. As a result, Governor Newsom has changed some guidance on Monday in relation to reopening metrics for Phase 2. We believe we have met all the criteria. We submitted a draft plan this morning and are currently in the process of meeting with the state to finalize our variance. I and healthcare agency are currently working on ensuring we get Orange County into Phase 2 as soon as possible. Today's press conference will have Dr. Clayton Chow, Director of Healthcare Agency, as well as Dr. Nicole Quick, our County Health Officer, who will be joining us on the phone. Actually, you are not on the phone. You are here. Lastly, we will have our CEO, Frank Kim, available to answer any questions as well. So I'm going to bring Dr. Quick out here.
Good afternoon. I'm Dr. Nicole Quick, County Health Officer. First, I want to acknowledge we reported our highest number of deaths in a single day here in Orange County. We extend our heartfelt sympathies to the friends, family members, and loved ones of the lives that we have recently lost to COVID. 10 out of the 14 were residents at skilled nursing facilities. Just yesterday, we reported an additional 10 deaths. 8 out of those were also residents at skilled nursing facilities. I want to spend some time today talking about the outbreaks we are currently experiencing at skilled nursing facilities. So an outbreak at a skilled nursing facility is defined as 2 or more confirmed cases of COVID-19 in residents in a 14-day period. We currently have outbreaks in 17 skilled nursing facilities in Orange County, 2 assisted living homes, and 2 in care homes. Our Communicable Disease Control Division is in weekly contact with our skilled nursing facility partners who work in infection control to continually update them on best practices and offer any needed assistance. We have hired a team of multiple physicians and an infection preventionist who conduct an on-site assessment within 24 to 48 hours for any facility that has more than 1 resident positive for COVID-19. We have designated our public health lab to assist with testing of any resident who is suspected of having COVID-19 infection, as well as with facility-wide screening. We have contracted with commercial labs to assist with resident and staff testing routinely and in response to outbreaks. We have contracted with academic infection control experts to conduct assessment and provide education in SNFs. We have also contracted with 6 nursing staffing registries that are readily available to support SNF staffing gaps and have established a response plan for supporting with emergency patient support services and activating ambulance strike teams for immediate evacuations if necessary. We have activated emergency medical technicians to staff 1 SNF starting on May 19th. Also, 2 have requested assistance from the California Health Corps for staffing need. Please know we are working around the clock to provide these facilities with all the support they need to treat and care for their residents and to mitigate the spread of COVID-19 infection. Now I would like to introduce Dr. Chow, who has an update as well.
Thank you, Dr. Quick. Good afternoon. My name is Dr. Clayton Chow. I'm the director for the healthcare agency. First, before I start, I just want to send a heartfelt message of condolences and sympathy, as well as prayers to the family of those who we've lost this last few days. sorry, get a bit emotional. So in response to Chairwoman Steele's inquiries regarding the COVID-19 recovery data, the OC Healthcare Agency research team has analyzed various approaches that other jurisdictions are using. We have identified an approach and will be reporting this data daily on our dedicated COVID-19 website, ochealthinfo.com/forward novel coronavirus, starting next Tuesday. Let me explain the formula we will be using. We will take the number of positive cases and subtract the number of deaths that have occurred over the previous 28 days. A point that is important to understand: mild to moderate cases, for example, folks who thought they just had the cold or cough and did not seek medical care, and asymptomatic community members who were never tested will not be captured. You have heard us say this before, but the recovery data will not be perfect. It is important to watch the trends over time for a more accurate picture of COVID-19 impact here in Orange County. So we do have our research manager, Dr. Curtis Condon, here with us, should you have any questions. Let me now transition to the important testing news. So if you remember, Chairwoman Steele had talked about this before, but I think it's important for me to repeat it and make sure that you get all the information. We have collaborated with the state, and we have now 4 free COVID-19 PCR diagnostic testing at OptumServe sites in Buena Park, Orange, Santa Ana, and San Juan Capistrano for symptomatic and asymptomatic healthcare workers, first responders, social service workers, and other essential employees who do not have access to testing through their healthcare provider or employer. So here's the important information that I want you all to remember. To make an appointment, please visit ochealthinfo.com/forward COVID test and scroll down to OptumServe. And the number you need to know is 1-888-634-1123. Let me repeat it one more time. 1-888-634-1123. Let's talk about the comorbidity research that the board have also asked us about, for those of you who follow the board meetings this last few weeks. I'd like to share some findings related to Orange County COVID-19 deaths and underlying health conditions. Our research team, led by Dr. Condon, analyzed data provided by the Sheriff Coroner. As of May 5th, there were 65 deaths reported in Orange County. 47 of those cases included available data for our staff to review. It is important to know that the process of death registration can cause a delay of a few days for the record to appear in the file that we look at. So here's what we've learned from our analysis. 62% were male, 38% were female, 66% was over the age of 65, 83% of the deaths occurred in a hospital settings, and 4% each at person's residence or nursing home. 76% of those who died had other complications in addition to COVID-19 that contributed to their death. Pneumonia, respiratory distress or respiratory failure, and cardiopulmonary arrest were the most frequent complications. Diabetes, obesity, and hypertension were some of the most common comorbidities. And finally, the majority of the classified COVID-19 deaths had 2 or more underlying health conditions. So that speaks to the frailty of our senior residents. Thank you. I'm available for questions. Now I would ask our CEO, Mr. Frank Kim, to come up to moderate the question and answer portion.
Good afternoon. I'm Frank Kim. I'm the County Executive Officer. Moderator, do we have questions from members of the media?
We do, and ladies and gentlemen, again, if you would like to ask a question, please press 1 then 0 on your touch-tone phone. And to remove yourself from queue, you can repeat the command 1 0 to take yourself out of queue. And today, please limit yourself to one question, and if you'd like to ask additional questions, please just re-queue up. And our first question comes from Paul Anderson. Mr. Anderson, please state your name and your organization. Mr. Anderson, your line is open. Is your phone on mute?
It's Paul Anderson with City News Service. Hello?
Yes, I can hear you.
Okay, good. Can you take us through the process of how you apply to the state for the variances that allow for the reopening of businesses in Phase 2?
Sure. Thank you for that question. So, as we all know, the governor on Monday issued a second regional variance application process. And as he explained during his press conference, that it really was intended for the larger urban counties. And since they've made that process available, we obviously have begun reviewing our criteria to ensure that we meet all the epidemiological criteria and other guidance that was required as part of that application. We've completed that review, had that discussion with our board on Tuesday, and as the chairwoman had indicated earlier, we did submit our initial plan to the state, and we have a conference call scheduled with them later this afternoon that Dr. Quick will be leaving around 2:30 for to discuss any technical questions that the state may have. So the process is that you submit your application, you hold that technical advisory consultation call, and assuming that they are satisfied with our application, then we complete our formal application process to be reviewed by the state public health officer. So I'm not sure what their comments are because we haven't had that technical call yet, but that is happening later today.
Thank you. And now to the line of Shayna Stabler. Ms. Stabler, please spell your name and state your organization.
Hi there, my name is Shayna Stabler, SHAENA-STABLER, Stu News. Thank you for the for allowing us to ask some questions and for all the information today. Can you please tell us in which category you're counting COVID-19 cases for patients that are currently experiencing homelessness, including sheltered or unsheltered individuals? Specifically, are these people being included in individual cities numbers, or are they in the unknown category? I've noticed this number is growing. It's at 240 right now. Also, can you please tell us how many cases of COVID-19 there are presently within the community of people experiencing homelessness? Also, if there are any deaths, and if there are any outbreaks within specific regions or shelters. I know it's a big question, but thank you.
Thank you. Let me ask staff to address that in terms of how we track the COVID cases and death within our countywide data.
Thank you.
Sure. So there was multiple parts to your question. I think what I would like to do is probably follow up with you after, if you could give us the details so that we can answer completely. If you're talking about individuals who are in a shelter and potentially were a case, they would be counted as where their city of residence were. But I think you had some details questions about numbers right now. So we will follow up with you after so that we can get you the latest numbers.
All right, thank you. And now to the line of Matthew Leslie. Please state your name and organization. Matthew Leslie, your line is open.
Hello, Matthew Leslie, Fullerton Observer. I'm wondering, in light of the fact that the CDC is estimating at this... Hello?
Yes, we can hear you. Please ask your question.
Yes, the CDC is saying that 80% of infected people have mild or no symptoms whatsoever. Shouldn't we be pursuing a strategy of testing asymptomatic people to find out what our actual infected rate of the county is? Because what I'm hearing so far is that the sites that are being described are for people who are frontline workers or people in a particular category, but not just anybody in the public. And it seems like we should have to do sort of a wider testing in order to determine what our actual infection rate is across the county?
Sure. So thank you for that question. We are certainly expanding testing actively every day. There are groups of asymptomatic individuals that we feel are very high priority in the county, and we are making a very concerted effort to test them. Those would be staff and residents at skilled nursing facilities as well as other congregate living facilities. So we are actively working on that, and we'll continue to expand our testing across the board in Orange County. I also want to get a little bit at what you might be asking as far as some sort of surveillance component in the county, and we are participating in surveillance study using the serology test with UCI in 3 different research studies. There is also an additional serology surveillance study that Hogue is completing. Some of the categories that will be touched upon in those serology studies are general population as well as healthcare workers, first responders, and we will hopefully from that data get a good idea of any sort of seroprevalence, and what I mean by that is number of people potentially previously exposed to COVID in the county. So we have those research studies going on as well.
All right, thank you. And now to the line of Spencer Custodio. Please spell your name and state your organization.
Hi, it's Spencer Custodio here, Custodio. I'm with the Voice of OC. Thanks for taking our questions. My question would be for Dr. Quick and possibly CEO Frank Kim. Given the 10 deaths yesterday and the 14 deaths today and the rising cases, is there any concern that, the state might deny the county's application to reopen more businesses like dine-in restaurants and some select shopping centers if it fits the criteria? And also, this one's for Dr. Quick. At what point, if the state does grant more reopenings, is there like a threshold in like hospitalizations or death number or, like a daily case increases or like a certain threshold where you might issue an order to scale back some of those reopenings?
So thank you for that question, Spencer. So I'll address the first part, and then I'll ask Dr. Quick to address the second part of your question. No, I'm not concerned that the state will deny our application. I think that they've set a fairly clear criteria, and it's a question of whether we meet that criteria or not. I think my greater concern is for our overall community, that if we see anything such as a rising case count, rising death count, those are things that we're very concerned about, really about the health of our community. I think that is really where my focus is. And to follow up earlier from the comments that Dr. Quick had made, that is particularly why we are testing both symptomatic and asymptomatic individuals in those higher risk areas. One of the contracts that we issued recently was for a private service, it's a lab, to go out and collect specimens and complete testing for both symptomatic and asymptomatic individuals in congregate living. And what that really means is we're going to visit every city jail, our county jail, juvenile hall, Orangewood, other programs like that. A city-operated homeless shelter, a nonprofit-operated homeless shelter, a county-operated homeless shelter, and we will address any issues that we see there. We will test them regularly. In fact, our goal is to be there at least once a month. So that is particularly how we are spending a significant portion of the CARES Act funding that I know many of the members of the media and the community had questions of. That is an appropriate use of that type of testing, and we think important to really bend the curve on what could be a large spread of infections within a really tight-packed community, such as in congregate homeless shelters or in other locations. Dr. Quick?
So to speak to the second part of your question and what we will be watching for going forward as sort of triggers for retightening down on restrictions, some of the things we will continue to monitor are the status of our healthcare system and to ensure that it can operate under normal operating conditions and not have to sort of expand outside of our Orange County or our region to care for individuals. So that will be one trigger we're following very closely. We will also look for unexplained increases in cases, unexplained increases in deaths, and any other sort of trigger that really shows that our community transmission and or outbreaks are beyond something that we feel like we have the resources to control. So to answer your question, while we have had these deaths in the last 2 days, which are absolutely tragic for all of us, these deaths are in our skilled nursing facilities in a known outbreak. So we will continue to monitor this and watch for all of these measures in our decision making going forward.
Thank you. And now to the line of Nick Gerda. Mr. Gerda, please spell your name and state your organization.
Hi, everyone. Thanks for taking questions. This is Nick Gerda with Voice of OC, NICKGERD as in David. I had a couple of questions. One about the 14 deaths today and 10 yesterday. Earlier in the week, there were a couple of days of no deaths reported, and then 10 yesterday and 14 today. I was wondering if one of the reasons why the death numbers were higher yesterday and today is because they occurred earlier and just weren't processed or reported until now, or if these new deaths are all just in the last 48 hours. And then secondly, whether the county now believes you meet the criteria for the state variants. As of a couple of days ago, Dr. Quick had mentioned some of those criteria had been met, some not yet met. So I was curious if the county now meets all of the state variant criteria.
Thank you for that question. I'll ask Dr. Quick to come up and address that. And please, for the members of the media, this will be her last response because she has to run off and have a conversation, a very important conversation with the state about that specific topic, about our variance attestation. So, Dr. Quick.
Sure. So thank you for that question. So the initial criteria that the governor put in the initial variants did include deaths in the previous several weeks. That is no longer a criteria for this variant. So we, as was stated earlier, we have submitted a preliminary plan to the state. We feel that we do meet the criteria, and I will be going through sort of a technical discussion with the state shortly here to discuss our plan and make any necessary changes. As to the question about deaths and the exact day they happen versus reporting, we would have to look back and get you more detailed data if there's a question about when that is. We generally are reporting deaths out on the day that they occurred, and once again, I've said this over and over throughout this process, we now have 2 days where we've been seen an increase in our deaths. We'll have to watch that over the coming week to see if this is a trend or if this was sort of a couple day increase, and we hope that it was just that.
Thank you. And now to the line of Margaret Carrero. Ms. Carrero, please state your name and organization.
Yes, Margaret Carrero, Carrero with KNX. This question is for Dr. Chow. You spoke a bit about the recovery data that will be placed on the website on Tuesday. Can you speak a little bit more about the importance of that and how that plays into the whole framework of dealing with this virus?
Thank you for your question. The recovery data, as I pointed out, is actually not accurate. So if you look at the entire state, there's about 18 to 20 of the mostly larger county do not post that number just because of the accuracy of does that truly a reflection of what's happening in the community? As we mentioned earlier, for people who have been infected but were asymptomatic, they didn't necessarily get tested, or for those people who have mild symptoms that did not go and seek medical care, they might not get tested, so they probably did recover, and there's no way for us to have that total number to make it for it to be accurate. Dr. Condon, if you have any more to add to that? Okay, thank you.
All right, thank you. And now to the line of Alicia Robinson. Please spell your name and state your organization.
Thank you. This is Alicia Robinson with Orange County Register, ALICIA-ROBINSON. And I guess I wanted to ask, with hospitalizations looking like they're trending upward and the number of positive cases appears to have spiked, can you explain why, if the state gives approval, why residents should feel comfortable going out and patronizing some of these businesses that may be able to open? And also, will you be making a copy of the plan submitted to the state available to the media?
Sure. So once we have completed our technical consultation, and if there is a formal plan that then is submitted following that, certainly we can make that available. That would become a public document. What I would say is that, number one, we know that in other counties that have opened, that residents have been exercising their own good judgment in terms of their own sense of their level of safety, in terms of whether they establish a restaurant that has dining within their facilities, whether they are going out and shopping in retail establishments. And I think that our Orange County residents have been incredibly, I think, responsible in terms of meeting the stay-at-home orders, and I think they will also exercise their own good judgment in terms of how they reintegrate once we are fully open within phase 2. From a county perspective, we look at our overall data and say, while we have had recent growth in terms of the number of positive cases and deaths, when we look overall at our overall picture, we are still doing incredibly well in comparison to large urban counties, as highlighted earlier by the chairwoman. And so we know that we have taken some really important immediate actions in terms of expanding the testing. If you go onto our website, there are over 15 different locations where residents can go get tested. Within a 30-minute drive of every resident in Orange County, you can come and participate and get tested at a community clinic. Most Orange County residents do have their own insurer and have access to their own health care. We do recommend that you attempt to utilize that process to get testing, because we think from an overall health perspective, it's always best that you're integrated with your insurer and your own doctor in terms of the management of whatever your condition is. And I know Dr. Chow would like to make some comments on this.
Thank you for that question, and it's a really important question. When we allow to expand our stage 2, all the business that are allowed to open, there is a guideline not only from the FDA, from the CDC, but also on the state website that would tell each business sector how to prepare yourself to reopen. And the state have very clear checklists, right? But in general, make sure the sanitization is available for everybody, clean their counter or places where people touch frequently on a regular basis. I know that a lot of business, a lot of different sectors have already go onto the website and get themselves ready for the reopening. So that's how the process works. Thank you.
Thank you. And now to the line of Olga Gregorians. Please spell your name and state your organization.
Hi, my name is Olga Gregorians. I'm a reporter with the Los Angeles Daily News, and I have a question about nursing homes. Federal authorities are urging governors to use extreme caution in deciding when to resume visits at nursing homes. And it sounds like they're saying it shouldn't come before all residents and staff have tested negative for the virus for at least 28 days. And I wonder if there's any kind of timeline for reopening nursing homes in Orange County.
No, I don't think that we have a particular timeline, and the nursing homes are operated by private entities. So absolutely, they are exercising their own good judgment. I can tell you that the healthcare agency has been out and conducted training exercises with them to provide guidance in terms of how best to mitigate and address the issues of COVID within those facilities. We've also provided guidance and participated in vastly increased level of testing for all nursing home staff as well as for the patients that reside there. So from a county perspective, we are in weekly, almost daily contact with the nursing home community and industry. And we are working with them hand in hand to ensure that they're taking all of the appropriate precautions to manage those facilities in as safe a manner as possible. But ultimately, in terms of when they provide additional or increased access to family members and others to visit their loved ones. That will be determined locally by each of those institutions.
All right, thank you. And now to the line of Jessica Genova. Please state your name and organization.
Hi, thank you all so much for your time. My name is Jessica Genova. I'm a reporter with ABC7 here in Orange County. So a really brief question. I wanted to talk to Dr. Quick, but unfortunately it looks like she had to step out. So whoever can answer this. But quick question followed by something a little bit in more detail. So I want to know, are we still at the 7,000 testing capacity for COVID-19? And, you know, I keep hearing that any Orange County resident can go to one of 15 locations to get testing with their insurance. Orange County has a very large undocumented and low-income population who is under or completely uninsured. So that's not a reality for these communities. They may not be frontline healthcare workers, but many are certainly in the workforce working essential jobs in the services industry. So who is making this call to not open up testing to anyone who wants to get that COVID-19 test? And where does that put us in terms of the variance application? Is that a requirement for variance?
So let me first say that anyone living in Orange County can get a test whether you're insured or not. I think some of the confusion potentially is because there are a number of community clinics, and they are testing those with mild or other that are generally symptomatic. We also have on our website those state clinics, and they are testing whether you're asymptomatic or not, or whether you're insured or not. And in fact, in all of our community clinics, whether you're insured or not, you have access to those programs. So what I would encourage those residents that may be uninsured or underinsured is to visit ochealthinfo.com, and there is a banner that runs across the front of the page. And if you click to the testing banner, it will then link you to the list of our community clinics. And if you're asymptomatic, if you go to the state Optum websites that are listed on that page, you can click on it and you can dial the number, or there's also a link to the website. And if you go to the website, you can fill out a questionnaire. If you're not insured, that is not a barrier, and you can schedule an appointment in that way to be tested.
All right, thank you. And now to the line of Chip Yost. Please state your name and organization.
Oh, hi there. Chip Yost with KTLA Channel 5. Two questions. One involving the nursing home deaths over the last 2 days. Of the 18, I believe it was, that were nursing home deaths, can you tell us which facility had the most deaths, or where the people had the most deaths associated with it of those 18? Secondly, do you expect to get the variance approved by the state? And if you do you expect businesses will open this weekend? And if they do open this weekend, what types of businesses could we see opening, and what would you want business owners to know about that?
Well, let me answer the second part of your question first, and then I'll turn it over to Dr. Chow related to your question on nursing homes. So again, we can't forecast the timeline in which the state will approve our application for the variance attestation. So we are hopeful that they do it as soon as possible, which is why we rushed to get the application into the state. And we're very excited for that because overall, I think our numbers in Orange County look very good. Our residents have been exceptionally responsible in abiding by all of the state and local orders. So we hope to have that in place and open as soon as possible. But as of today, I could not tell you exactly when we will get approval from the state. That is a process, and we're following it, and we will do everything that we can at our level to expedite that approval and ensure that our application is complete and addresses any questions or concerns that are identified through this technical process that is happening as we speak today. Dr. Chow.
Thank you for your question. As it's related to posting the name of the skilled nursing facility where the resident passed away, that's not something that we post to the public. So thank you for your question.
All right, thank you. And now to the line of Wally Jerkeshin. Mr. Mr. Sarkisian, please state your name and organization.
Yeah, it's Wally Sarkisian, gagrule.net.
Please ask your question.
Yes, we are in month May, 5 months since the pandemic, and still general public are not able to get tests. And I called a couple of hospitals or medical centers. They say it's only available for people who has a problem. So when you guys gonna make it available for general public, at least for 65 and over, and also asking the hospitals and doctor offices to do this test for people without a problem.
I believe I did answer that question earlier, but I would encourage you to go to ochealthinfo.com, click the banner link that takes you to the testing website. If you are asymptomatic or over 65, you certainly can access any of the health clinics. If they're all free. I know that when you do apply through that process, there is a phone number that you dial. You will have a consultation, and there'll be some questions from the clinic in terms of setting up a case file, etc. If you select to go through and do that process online, there are, I think I went through the process yesterday just to test how the program works. You answer a series of, I think it's probably 15 or so questions. One of the questions is, are you insured? And if you are, they will ask for your insurance information. But if you're not insured, that is not a barrier to you. So please understand that you can access free testing for anyone in Orange County, whether you're insured or not, through ochealthinfo.com by selecting the testing banner. It is available for all. One more question, please.
Thank you, and that comes from the line of Corbin Carson. Mr. Carson, please state your name and organization.
Yeah, Corbin Carson, Carson, KFI News. Most of my questions have been answered in relation to the spike in deaths at skilled nursing homes, but can you tell me how many COVID deaths the county has had overall from skilled nursing homes? And then also, to be clear, is the county's position that the spike at the nursing homes is not related to the county's push to reopen? And finally, is the county's response to keep these people safe at the homes mainly about more testing and monitoring?
Sure. I believe on our website we do identify the number of deaths as it relates to skilled nursing facilities. And in fact, if you wait, I'll check it on my phone. I have it right here. So let's see. 40. So of the 112 residents in Orange County who have passed away, 40 are from skilled nursing facilities. And that is on our ochealthinfo.com website on our indicators and statistics page. So thank you all very much. I appreciate you all calling in, and we look forward to another presentation next week.